Emma, how has COVID actually affected Endometriosis UK as a charity? Because I'm obviously we've seen a lot of impact on charities as a whole.
Well, we've actually had our busiest year. I think you'll find that with a lot of medical charities because all the surgeries and appointments were cancelled. And so we worked at the beginning of the pandemic with some great people from our medical advisory panel to make sure there was guidance out there for people who might need help and couldn't access it. And that means we've been trying to put on webinar series and a whole range of things. I think the thing for me is the real concern going forward for those people who are awaiting treatment and awaiting appointments, and really when that's going to happen, because again, you know, we all understand why everything's been delayed. There's been a global pandemic, but if you've been waiting for surgery for 14 months now and you thought it was going to happen last, March, it can be challenging. And I think it'd be interesting to hear Shaheen's perspective on that. And also from my perspective again is about what can we learn from the pandemic in terms of things like where it's appropriate having phone appointments or, at least letting everyone know about things. Certainly I was talking to one of the health boards in Scotland recently, and they've actually written to all their patients to say, you are on the list. We haven't forgotten about you. And even something that simple can just really reassure people. But how are you finding it, Shaheen? It must be really challenging for you.
Yes, extremely challenging. Well, a few things have come out of this pandemic, some positive. In fact, we've learned that we can do a lot by virtual consultations. As long as we've examined the person once, a lot can be done, the counselling, the discussion, and particularly for our centre, that's very useful because a lot of our patients come from all over the place, basically, and have a long way to travel. And therefore, that has been a positive. What has been extremely challenging is that the patients had to wait much longer for surgery. We've been lucky because we've had, my NHS trust has had an agreement with a private hospital to do some of the NHS work in the private sector. And I think that has been another good learning, that the lines between the private sector and the NHS have blurred to some extent for the benefit of the patient. And that has been very positive, seeing that actually, regardless of who's paying for the treatment, everybody wants the same thing, and that's to help the patients. But I'm glad to say that we are starting, as of 19th of April, hoping to start normal activity, doing the elective operations as we did with full force. And we're hoping to be able to reduce the length of the waiting list by doing that.